Hi, I'm Dr. Peter Lind. In one of my treatment rooms, this room we use for upper body ergometry with oxygen or exercise with oxygen. And let me explain that to you. Most people with neck pain or back pain have an oxygen deprivation problem. And I'm not talking about the total concentration of oxygen. That's measured in the hospital or any doctor's office. But I'm talking about the tissue perfusion. So we take an instrument that looks like this, and we put a little instrument over your finger, and we take a reading. And the first reading we'll get is a total body concentration of oxygen, and then the next, we push a button, and then the next reading we get is a tissue perfusion, and that's the amount of oxygen that's actually perfusing into the tissues. And most people with neck or back problems are very low. You cannot heal if you have a low tissue perfusion of oxygen. And so one of the remedies that we do when we find this with people is we give them oxygen concentration and upper body ergometry. In other words, we help push the oxygen deep within the tissues. Now everyone knows that with an increase in oxygen, you heal. And without it, you don't. Cells die, they become old, and they don't work as well. So with the advent of oxygen, we've really been able to help a lot of people with neck and back problems overcome and actually heal and correct. Again, that's one of the basics. Oxygen, glucose, making sure that the fatty acids are good. Once the metabolics is set, first you have to test and find out what's going on. You run lab tests. Then you can lay out a program to get that healed. At the same time, you work on the more mechanical problems of neck and back problems. Again, the neck is connected to the back. It's all one unit. And oftentimes with people, you have problems in one area that create problems in another area. So you have to work on the whole system. You can't work on one area. And in one of my other teachings, I talk about surgery, and well, let me just mention, surgery is, when it's indicated, it's very appropriate and helpful. But most of the time, it's not indicated. And we find many people that have failed back surgeries that walk in here with 1 or 2 or 3 different kinds of surgeries, and it's like they're worse off than they ever were. They've got scar tissue and adhesions, and the tissues are just a mess. And so you don't want to wait till that happens. You want to look to find out what's going on so you can get the problem really fixed and corrected before it becomes progressively worse, as oftentimes neck and back problems do. So again, you find out what's going on metabolically, you look at the whole system, finding out if you have imbalances that really need to be fixed and established to normalcy. And then at the same time, you work on the more mechanical, the bones, nerves, and muscle problems of the person. And with that combination, boy, you can really see some changes, dramatic changes with people that they've not had in years and years. So hopefully this has been helpful for you. Exercise and oxygen and finding out the metabolic components and bringing relief to the whole person so the whole person can get better, so you can get better. So this is Dr. Peter Lind, and I'll speak with you again next time.